within there's several other books that I found to be interesting. One is you're probably familiar with Jaws is a become a popular one. Shut Your Mouth,
Yes.
Save Your Life, I think is another. It's like George Carleton or Catlin or something. Maybe Catlin, I think is his name. That was written like a couple hundred years ago, and he was I'm pretty sure his name's Catlin. And originally he was like a lawyer, had some kind of like normal job like that, and he was also an artist, and then ended up going and doing paintings and also just generally researching Native American culture. So kind of like leaving the colonials and going and spending time with Native Americans, and just seeing the really impressive juxtaposition between the dental health of his culture, like the right culture, the correct, the righteous culture, and then going into these these savages and seeing how brilliant they were from at least like a musculoskeletal dental orthodontic perspective, and a part of the conversations there with Weston A. Price as well was not just the vitamins and minerals and the nutritional content, but also the having to chew, and having to actually so when you're in this like baby food, like adults are eating baby food, and babies are eating baby food. I don't know at what point maybe babies need baby food. I'm not sure. That'd be interesting. I'd be curious your perspective on what a baby should be eating to develop proper jaw and orthodontic health. But that's so it's not just the nutrients, but it's also the textures and actually the process of chewing. Treating your mouth and your jaw like a muscle, which it is.
Yes, super interesting and super good question. So if we start with the babies here, baby's best is breast, because when the baby, I don't know if you, I just say sucks on the nipple. I don't know if you say that. Yeah,
that's right.
The jaw, the lower jaw, grows forward. And the best strategy, if the mom is able to do so, is to breastfeed the baby for at least 18 months, 1.5 years, because of this jaw movement. But also, so you need 10 times more strength with this muscle to pull that jaw forward in comparison to sucking on a baby bottle.
Wow.
So that's a lot of basically orthodontic work already. But also, and if you have kids, you will know, if they have clogged noses and then they try to suck on the nipple, they're like, they're almost dying. So what they normally train, if they're on the nipple, they train nose breathing all the time. They can't breathe without their noses. So already 1.5 years, perfect palatal shapes. Wow. So the nose breathing will develop a wider jaw. Whereas when you get allergic and have all these inflammation in your mouth later on with standard American diet, then you probably have clogged noses and start mouth breathing. So like I did as a kid. And then obviously everything changes from there. And as an adult, obviously, if you eat soft foods all the time, all these muscle degenerate. Obviously you cannot really chew your smoothie, but you should start eating harder foods.
Well, you can put crunchy, from an amylase perspective, you can put crunchy stuff in there. So put some cacao nibs or walnuts or mac nuts or whatever you do at the end, give it a little, and then you'll chew each one.
Yeah. Obviously. Yeah, but really the physical part of chewing trains the whole skeletal system. And also what's really important when we come to the jaw and its alignment, if it's perfect, then this is kind of like the thermostat for your whole body posture. Upper and lower jaw, they have this occlusal plane, which is totally what do you say in English? It's kind of like parallel to where your eye level should be.
Yeah.
So there is this labyrinth the writing reflex that all mammals look to the horizon, and if they have a relaxed posture, the jaw is also aligned. But if that misaligns due to dental work or to poor crowded teeth, everything needs to be aligned in terms of these tiny neck muscles. So your body just adjusts so that your eyes still be parallel to the horizon, to this reflex. And this makes then problems kind of like this. You get a hunchback if you have problems there. I can sing songs because of this, because my upper and lower jaw don't fit. And that's also not just a problem with the posture here. It's also, there's a joint called temporomandibular joint. And it's just a tiny joint, which is the joint that opens your lower jaw. But this joint is really much important because 50% of all nerves and blood vessels travel through that joint in your brain and outside of your brain. And if you get tight because of clenching teeth or poor alignment or also various other stressors in your mouth, you cramp up here. This one gets tight, which is a sympathetic stressor, but also leads to less blood supply in your brain, which further on leads to less neurotransmitters, depletion of acetylcholine. There's even a study showing if you just have a loss of bite height for 1 millimeter, that's normal for, let's say, people that had dental work done, 50% less blood supply in your brain and less drainage of your brain. And then you can imagine how it all clogs up, and then you get this hunchback and everything get tied up. You get shoulder frozen. What is that in English?
Frozen shoulder.
Frozen shoulder stuff, and it's all just related to the stressor in your mouth. So it's really, really important to get the bite as one of the oral interference field problems. You probably know that.
Can you elaborate a little bit more on specifically how the mechanics of the bite, whether you have an overbite or an underbite or it is balanced, how that trickles into spinal function? So it's associated to the righting reflex. Our eyes always want to stay horizontal with the horizon. But how does this draw forward, backward, or perhaps like a malocclusion or like a lack of spaciousness in the upper palate, and that kind of like, what do they call it? What is it called when the upper palate goes in? It's called like a bell palate or something. Yeah. That's what I had. It was terrible. Oh my God. I had like the key thing every time. I could feel my jaw cracking as I was doing it. It was really impressive. But can you just elaborate a little bit more on that connection between how this mouth actually potentially trickles into something like the scoliosis or some type of imbalance in that? I know you just said it, but
I tried to make it easier. Yeah. Okay. I think for my personal experience, but also with thousands of patients, is number one is just the malocclusion. Like, can you bite evenly if you bite? Like, do you have a stable bite left and right?
Yeah.
For me personally, I have only one hitting spot on the right side. Left side is like kind of loose. So I think if you have an alignment, if your teeth are crowded, or you have a forward bite or backward, like a protrusion or retrusion, I think that's second. It doesn't really matter as long as this is stable first. Stable first is the most important, and the right height, because this is basically telling your atlas and axis, that's your first two vertebrae, that they need to be like aligned at the back. I think the forward occlusion, like when your lower jaw is too big for your upper jaw or your midface didn't grow enough, there's different versions. It's called let's say just protrusion of your lower jaw. If you see that from the side, if you would look at people that have this in the overall spine position, it feels like, or it looks like the whole body is trying to compensate in terms of pulling the whole body backwards. Like they will have maybe a bit of an overarch in their lower spine, and they're not loose. They cannot have their arms loose. It's more like all pulled back to compensate for this forward thing. Can you imagine what I mean?
Yeah.
Whereas the opposite happens for people that have this, the lower jaw too far in the back.
Yeah.
A posterior lower jaw. Then obviously the back changes. It's more like let me translate it. It's probably then more posterior pelvic tilt and more forward rounded shoulders. Yeah, but there's different sorts. For example, I have my lower jaw seems to be more forward, but if you look at it really, is not my lower jaw the problem. My upper jaw isn't really grown because I had a lack of nutrients, like you had this bell-shaped palate, and basically I'm missing mid-face. So this is something you need to consider. Whatever it is, it's really important that the occlusion is stable and balanced, and there's no like height loss, because the height loss is probably the most important, because it will then translate to having less blood supply to your brain and being more cramped up in this temporomandibular joint, and all the lining muscle here, like you will clench more, you will grind more, masseter will be hypertrophic or hypertonic, and all these muscle in your jaw, like below your jaw, the inside, there's something called the pterygoideus muscle. They get super tense, and this is a stressor in itself, because these nerves can't come out anymore, and then you cramp up, you can't really lose the toxins from your brain, your lymphatic system doesn't work very well, you get tight upper back, you maybe even get shoulder arm syndrome, you cannot contract your biceps or your arms pretty well. Why? Because the plexus where all the nerves come out for your arms is here, and it's all tied up because of problems in your mouth. And it's not just the bite. Basically everything that's been done, like it's an inflammation, like we said at the beginning, from the cavitations or around the tip of a root canal, or just heavy metals in there, all this can lead to various postural problems and overall issues, also obviously connected to the vagal nerve if that's always stressed. I have patients, because of this inflammation in their jawbone, they haven't had any vagal tone for 30 years. We call it toxic vagus syndrome. And it's just because of the stuff in the mouth. It shuts down totally. And imagine if your vagal nerve doesn't work anymore. You're always in sympathetic. Your organs won't work, your digestion won't work, nothing works basically. You feel like really bad.
I have two questions I'm really excited about, but they're both completely different, so I'm going to have to remember to ask them both. The one is your thoughts on mewing. I don't know if you're familiar with John. I think his name's John Mew. This is the thing where you put your tongue up to the roof of your mouth, and he has some exercises, and you like forcefully press your tongue up to the roof of your mouth to create space in your upper palate, and also reintegrate the tongue. So his perspective is a majority of postural issues are he would probably argue are rooted, or at least integrated with tongue posture and the tonicity of the muscles in and around the tongue and the throat. Do you have any thoughts on tongue positioning and posture and exercises, and the ability for the tongue to perhaps act as somewhat of like a retainer for the jaw?
Yes.
And then perhaps, it's a retainer. Can you actually start to change the structure of the face? Because there's pretty impressive photos that I've seen from people going through the technique.
I was just wondering if I find it. Wait a second.
Yeah.
I just, funny enough, a patient just gave me this. It's called a face former.
Oh yeah, I've seen that. I've seen different versions of it.
I haven't tried this one yet, but obviously I had to, because of my bell-shaped palate and tons of orthodontics, I had to go to a logopedic person back then, and they will train you all these things. For example, where your tongue should be, because I was a mouth breather, because of allergies and everything, my tongue was in the lower jaw, and therefore my palate even collapsed more. So what I had to train before we widened my palate was to have my tongue where it's supposed to be, and it's supposed to be on these little wrinkles behind your front incisors. Everybody can feel that if you touch your upper incisors inside the gum. There are these wrinkles, and that's where your tongue should be. And this is then basically holding the structure there and everything. Yeah, obviously you can train. I haven't done the face formers yet, but I'm a big fan of osteopathy. I'm a big fan of all these muscle techniques to align everything. I don't know if I would say it's all related to just tongue things.
That's what everybody says. If you go see an AO chiropractor, they'll say everything relates to the AO. If you go see, maybe a biological dentist, they'll say everything relates to the teeth. If you go see a rolfer, they'll say everything relates to fascia. We have our tunnel vision windows on things, so that's why it's like, from that lens, it's like, wow, because that's what I see, and that's like I see it everywhere. But ultimately, I think it's all just integrated if you really draw back enough, and if you meet enough people that are specialized in enough things, you start to be like, oh, okay, I think you're all pretty much right, and also kind of missing it.
Yeah, totally true, and I think I've been the same becoming dogmatic if you learn something and then you see it everywhere. That's just normal and part of the process. But I think at one point, if you like learn so much and do it for such a long time, you start integrating everything and understanding how it all connects. And for me, it's more fascinating. Obviously, we have to do the 80-20 and get the shit out of the bodies and of the mouth of the patients. And using everything that I've learned so far in terms of being it the tongue posture to using myofascial release techniques or myoreflex techniques, like everything I've learned and I'll integrate. But what I learned basically in functional medicine, and I'm also a naturopathic doctor, is the timing of these various tools. For me, these are just tools in the toolbox. I get one patient and that's one art piece that I want to help. This patient needs to become optimal healthy. At least that's the challenge. So I will use everything I can to help him. But a big missing part is, like you also said, is that you don't look in your mouth as part of your body, and obviously not in medical world and dental world as much as you should.